First, let me show you the 3 most common bad postures that I see in patients in my practice. And I'll also show you what it looks like on a spine model. And I'll also show you the corresponding x-ray of these bad postures. And understanding how these bad postures look like anatomically, what the anatomy of these bad postures look like, will get you to understand what's really happening to your body and your health with bad posture. The first bad posture I commonly see is a forward head position. Now, with a forward head position, you will notice that the head is driving forward from the side view. It'll look like the head, use the ear as a landmark, is forward away from the shoulder. It's moving forward away from the shoulder. And on a spine, this is what it looks like. So we look at the spine. Here's the neck position. The head sits here. So this part of the spine should be around where the shoulder is, right about here. So when this goes forward, you'll see that the neck is actually driving forward over here. And that can also flatten out the spine. It could also round up the upper part, cause that neck hump that's commonly referred to as a dowager's hump or upper back hump over here. So that's what a forward head posture looks like on the spine. This first x-ray I'm showing you is an example of a forward head posture. Now, what you're looking at here on the left side is an example of what a normal neck looks like. You see this green line, the neck is circular in shape, okay? On the right side is an example of a patient profile, okay? Now, the green line is where the neck should be, right there, and then the red line, the red dashed line here, that's where this patient's neck is. So this is C2, this is C7, and this should be in line. When C2 is forward ahead of C7, that means there's a forward head position, forward head translation, puts a tremendous amount of pressure and weight on the upper back and shoulders, and also on the neck that can accumulate degenerative changes here, and also neck pain, neuropathies, numbness, tenderness of hands and fingers, headaches, muscle tension, and muscle tightness. So this is an example of a forward head position posture. The second most common posture to see is a thoracic flexion. In fact, that means that your upper thoracic, your upper back is flexing and bending forward. The problem with that is it also drives your head forward into a forward head position. So these postures are often coupled. And what a thoracic flexion posture looks like on a spine model is like this. So here's the head, here's the neck, here's the upper thoracic, here's the mid-lower thoracic. When the upper thoracic is bending forward, it's doing this, okay, bending forward. So the upper part of the thoracic spine, T1, is in front of the T12 area. So that's we know it's a flex posture. Look at the neck. The neck is also drive forward. So it's a coupled posture, head forward position, driven by the upper thoracic spine. And I'll show what it looks like in an x-ray in a moment, but this is the reason why you need to analyze the structure of the spine, not just posturally on the bottom, but also on x-rays to determine how to fix this structurally. So this x-ray is now showing a classic thoracic flexion posture. This image here on the right of your screen is a patient x-ray, and this will be here is a comparison of normal. So normally the head should be over the shoulders, shoulders over the lower back over the pelvis, and the spine from neck to mid-back has this shape here. This is the ideal shape of the spine based on research. The neck is circular, the mid-back is elliptical in shape, the lumbar spine is elliptical in shape over here. So the green line is where the patient should be, and the red line is where the patient is. So here's the neck position. And over here is the thoracic area, and this is the lumbar area. Now, this dashed line, again, represents the patient. So here is the upper thoracic region, T1. Here is the lower thoracic region, T12. When T1 is forward in relationship to T12, then we know we have a thoracic flexion posture. You can see this entire shoulder, rib cage, upper thoracic spine is flexed forward. One of the consequences of this forward flexed posture is not just affecting the thoracic spine, but look what's happening to the neck. It's driving the neck forward. And this is why I keep telling people exercise is not enough. If you just focus on exercising the neck and bringing that back with chin tucks, you're not really addressing the thoracic spine at all. So we need a full spine corrective approach. Also, what I want to show is it's hard to see here, but there's degenerative changes happening here. There's degenerative changes happening here, and there's degenerative changes happening here. Why? Because the actual upper body weight and load, as it's called, is now over this spot here over space and not through the body column. And that's why the load of the body is not distributed properly, and the stress has to accumulate somewhere, and it accumulates at all the bend points, okay? All the major bend points. So again, that's a classic flexion, thoracic flexion posture. The third most common bad posture I see in patients in my practice is called thoracic extension. Think of thoracic extension as the opposite of thoracic flexion. So in fact, the upper thoracic, upper back is going backwards in relationship to the pelvis, and the head now is driven forward. Not a spine model, this is what it looks like. So again, here's your spine in neutral position, upper thoracic, lower thoracic. When T1, upper thoracic, is going backwards like this, so backwards in relationship to T12, that's now called thoracic extension. Now, no one's gonna have their upper thoracic backward extension and their head back like this. Now, the actual balance mechanism of your brain to make sure everything's balanced is going to drive the head forward. So an upper thoracic posture will also drive the head forward. So it's causing a couple bad posture positions.
Now, this is a classic thoracic extension posture. Think of thoracic extension posture opposite to thoracic flexion. In this case, you'll see that the upper thoracic spine is now behind the lower thoracic spine, okay? So you'll see how this is behind, okay? And when it's behind, that means that there's an extension of the thorax or thoracic spine. Another consequence of this is because here's the reference point, okay, and the head reference point is at the ear. You'll see that the head is also driving forward as this is driving back and into extension. So all these postures are combinations typically. You're not going to typically find one abnormal posture. Again, there's another reason why you can't just work on the neck position with exercises, or you can't just work on the thorax position. You have to work on a combination of all of these. All of these have to be corrected, okay? So again, the red line represents where the patient is, classic extension posture, and the green line represents where the patient should be.
I hope you can understand now and see why exercise alone is not enough to fix bad posture. Exercise alone does not address one key aspect of posture and spine correction, and that's working on the structure of the spine. If you remember back at the x-rays I showed you, every bad posture position has a corresponding spinal misalignment, and that's for simple cases. When the posture doesn't match the spinal alignment as seen on x-rays, that's a more complex case and requires more complex corrective techniques and methods and protocols. I'll talk more about the three-step approach for correcting bad posture and spinal misalignments later on in the video, so keep watching. So what do you do to correct bad posture if exercise alone is not enough? What's needed is a combination of postural correcting exercises, postural correcting adjustments, and also traction methods, and traction methods that focus on correcting the alignment problems and misalignments in the sagittal plane and coronal plane of the spine and posture. And the technique that covers all three of these components is called chiropractic biophysics. Chiropractic biophysics, or CBP for short, is a full spine, full posture analysis and corrective protocol. It utilizes not only postural assessments, but also spinal x-ray analysis. If you had bad posture and you're concerned about your posture and what it could be doing to your body and your health, you should get checked by a corrective care chiropractor or a chiropractic biophysics trained and certified chiropractor. If you like help finding a corrective care chiropractor, comment below and let me know, and I'll refer you to a directory, an online directory of trained and certified chiropractic biophysics doctors. You'll find many across the United States, you'll find many in Canada, and also in other parts of the world like Europe and Australia. Comment below and let me know if you want that doctor directory. Now, if you want to see some of these corrective methods in action, go ahead and watch this video right here where I show how to correct forward head posture, forward head position using corrective adjustments. And these corrective adjustments complement the postural exercise that you see often on videos online. So go ahead and watch that video right here, right now.